Cephalometry. Cephalometry is a standardized lateral radiograph of the skull. The standardized lateral radiograph of the skull, or the cephalometric radiographs, is taken by using a cephalometric X-ray. The cephalometric X-ray composed of the X-ray source and the sensor collimator in addition to the cephalostat. Cephalostat used to position the head of the patient in a standardized lateral position. The standardization of the lateral position of the head of the patient is to produce the same lateral cephalometric radiographs at different occasion, at different time, and can be taken by orthodontist. The cephalostat composed of two air rods. The two air rods is uh, put in the external auditory meatus in addition to the anterior rod that that put in the nasal area of the patient. Here the position of the sensor and the source of the X-ray beam is passed through the external auditory meatus to produce a standardized lateral cephalometric radiograph of the patient. And here is the position of the cephalostat. Is the same on the dry skull, the position of the cephalostat and the position of the anterior rod corresponding to the nasal position. Here the standardized lateral cephalograph. The cephalometry used for the diagnosis of craniofacial deformity and the diagnosis of orthodontic cases, in addition to the study of the craniofacial growth of patient to diagnosis if there is a various growth pattern between the patient. Another use of the cephalometric radiograph in the treatment planning and in the cases of evaluation, the treatment cases after the treating of the patient with an orthodontic or orthopedic treatment, the assessment of the progress of the treatment, in addition to identify any causes of an orthodontic relapse after the removing of the orthodontic appliance, and evaluate the stability of the treatment of the malocclusion. The cephalometry or the lateral cephalometric radiographs are analyzed either by using of the hand and pencil in a dark room and traced, or more recently using a computer-based cephalometric analysis, which the lateral radiographs, cephalometric radiographs, entered in a program in the computer and analyzed to determine the radiographic point and landmark, in addition making the plans or the planes of the radiographs, and finally making the analysis of the cephalogram. The most important points that appear in the lateral radiographs is the cella, or and here appear in the radiograph the midpoint of the cella torsica and its called or the cella or the S point. The porion or PO, it's represent the most upper and outer point of the bony external auditory meatus. Asion also represent the most anterior point of the frontonasal suture, or the deepest point of the nasal bone. The orbitale is the most inferior position of the anterior point of the margin of the orbit or the inferior orbital margin. Another point is the anterior nasal spine. The anterior nasal spine represents the tip of the anterior process of the maxilla or the most anterior part of the maxilla, which is the ANS point. Another point in the cephalometric radiographs is the posterior nasal spine point or PNS point, and it's represent the tip of the posterior nasal spine of the maxilla. The point A, which is an important point and represent the the point at the deepest concavity of the anterior profile of the maxilla as appear here in the X-ray. And the point A is corresponding to the position of the apex of the anterior incisors. The menton point represents the most lowest point of the mandibular symphysis, and another point in the mandibular symphysis is the pogonion, which represents the most anterior point in the mandibular symphysis. In addition to the point B, as it is the point A, it represents the deepest point of the anterior concavity of the anterior surface of the mandibular symphysis. The gonion is the most posterior and inferior point at the angle of the mandible. Here is the gonion. Now, the planes that composed by connecting between the points, the most popular line or point or plane is the SN line or SN plane, which is represent the cranial base or the anterior cranial base of the patient. And this plane is connecting the S point and N point or the sella to the nasion to forming the SN line or SN plane. Another plane is the Frankfort plane, which is connecting between the porion point and the orbitally or the point at the inferior orbital margin. This is the Frankfort plane. Another cephalometric plane is the maxillary plane. The maxillary plane is connecting between the anterior nasal spine and the posterior nasal spine. The functional occlusal plane, which is the plane that connecting between the tips or the cusp tip of the posterior teeth and the incisal edge of the anterior teeth, which is called the occlusal plane. And the mandibular plane is the plane that connecting between the menton and gonion, and it's represent the mandibular plane or the tangent to the lower border. Thank you.